In this video, you're going to find out three major symptoms of severe L405, L5S1 disc bulge. Keep watching. If your MRI reported that you have an L405 disc bulge, an L5S1 disc bulge, you have back pain, leg pain, trouble moving, pain at night, pain in the morning, any symptoms associated with L405 disc bulge or L5S1 disc bulge, well, you need to be aware of these three major symptoms. This is a public service announcement, and it's important to know these three major symptoms because if any of them occur, it's an immediate required visit to the emergency room and may possibly require immediate surgery once you get to the hospital. Not only am I going to show you in this video what these symptoms are, these major symptoms of severe L405 disc bulge or L5S1 disc bulge, but I'm also going to show you with a spinal model and some anatomy charts, the structures and organ systems that are involved to kind of tie it in together.
Hi, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to stabilize and strengthen your back. Like this, you can bend, move, and lift normally and without limitation. If you want these tips and strategies, you want to learn about structural correction of the spine, then stay tuned to this channel, subscribe below, tap the notification bell. Like this, you don't miss out on my weekly video updates. Now, to understand these three symptoms, which I'll explain in a moment, let's look at the anatomy of the lumbar spine and where these discs and nerves are involved. Then I'll show you a nerve chart where these nerves go into the legs, and then I'll show you that chart down there and which organ systems are actually involved in a potential severe L405 disc bulge and L5S1 disc bulge that would require an immediate visit to the hospital emergency room. So here's a spinal model. Here's the L5S1 disc. Here's the L405 disc. When there's a disc herniation, it usually goes posterior or posterior lateral or central. And when it irritates the nerves, so this L5 disc bulge may irritate the L5 nerve or even the S1 nerve, and this L4 disc bulge may irritate the L4 nerve or even the L5 nerve, depending on which part of the nerves it's irritating. So when these disc bulges become severe and advanced and they go right into the spinal canal and take up most of the space in the spinal canal and compress on the cauda equina nerves, which are made of the lumbar nerves, then they also may compress on the sacral nerves that lead into the sacrum over here, and that will lead to a condition called cauda equina, which is involved with these three symptoms you need to be aware of. And I'll explain the symptoms right now and also demonstrate it on anatomy charts. So here are the three major symptoms of severe L405 and L5S1 disc bulge you need to be aware of. Number one, if there is pain shooting down both legs or weakness, muscle weakness in both legs, so severe sciatica-like pain that shoots down from the buttock right down to the feet and the toes in both legs. That's the thing to be aware of, both legs. It's not very common for an L405 disc bulge and L5S1 disc bulge to actually irritate the nerves of both sides of the lower extremity. Usually it's going to be unilateral, one-sided. So it may be like a left L5S1 disc bulge that will irritate and cause leg pain down the one side, or a right L405 disc bulge or a right L5S1 disc bulge that causes pain shooting down the right side. And it's uncommon to have both legs with either weakness or shooting pain down both legs. So if that's one of the symptoms that appears, that requires an immediate visit to the ER because it's a major symptom of severe L405 or L5S1 disc bulge. As you can see that the lower lumbar nerves that are irritated by the lower lumbar spine, okay, over here, if there's a severe blowout of those discs, can irritate both sides into the legs. So that's symptom number one of cauda equina syndrome.
The second major symptom of severe L405, L5S1 disc bulge is called saddle anesthesia or saddle paresthesia. Let me explain. So here is a nerve chart. So here is the lower back, and here shows the nerves of the lumbar spine and sacrum that feed into the buttock area, the anus area, and down into the legs. So when there is a severe disc bulge at L405 or L5S1 that is compressing into the spinal nerves inside the cauda equina of the lumbar spine, if it compresses deep into the sacral nerves, it can actually affect this area here of the buttock and cause it to become numb. So the saddle area is the area, imagine if you were to sit on a horse on a saddle the area of the buttock and inner thighs that's touching the saddle is called the saddle area. And when that area is numb over here, then that's a serious symptom of severe L405, L5S1 disc bulge. And it requires an immediate visit to the emergency room to get it analyzed and check it out, and may actually end up in surgery. Now, how would you know if it's numb there? Because it's not a common area to know. Well, when you go to the bathroom and have a bowel movement and you wipe yourself to clean yourself up, if you notice that it's numb as you're wiping, that may be an indication of saddle anesthesia or saddle paresthesia that needs to be immediately checked and have an immediate visit to the emergency room of the hospital. The third major symptom of severe L405, L5S1 disc bulge are symptoms related to urination and bowel movements. If there is urinary retention and urinary incontinence, or inability to have a bowel movement, especially within 24 hours, then that will require an immediate visit to the emergency room as well. Urinary retention means that you have the urge to want to go and urinate and eliminate your bladder, but you're unable to do so because there's a neurologic compromise from that disc bulge to the sacral nerves. I'll show what that looks like in a moment in this chart over here. Urinary incontinence means that you can't hold your urine and you can't hold your bladder, and there's leakage. Both of those are serious major symptoms of severe L405 or L5S1 disc bulge. And of course, if there's inability to have a bowel movement that's not related to anything else, like let's say medication or something different, and especially if you feel like you have a need to want to eliminate or have a bowel movement and you can't because there's neurologic compromise that's related to Claudia-Quina syndrome, that also requires an immediate visit to the emergency room as a severe symptom of L405, L5S1 disc bulge. And let me show what that looks like right here on this anatomy chart right here.
So the nerves that control the bladder and the nerves that control the colon are deep sacral nerves. Some of the colon is controlled by the lumbar nerves as well. So in order for the bladder to be affected, the disc bulge would have to irritate the very deep sacral nerves that are very rare to be injured by disc bulge. It would only occur with a progressive severe L405 disc bulge or an L5S1 disc bulge that irritates the sacral nerves that goes to that region there. As well as there's also problems with sex glands or sex organs. That would be another reason to investigate this further. So that's the connection with the lower L405, L5S1 disc and the sacral nerves that goes to either the colon or also the bladder. Now, these three major symptoms of severe L405, L5S1 disc bulge, I want you to understand that they're really, really rare. Claudia-Quina syndrome in and of itself is really rare. In fact, in 21 years of practice, I've only ever seen one patient that actually had that. And because he had urinary retention problems, he had to go to the ER and ended up in immediate surgery. So it is worth it for you to at least be aware of these, have a discussion with your doctor, your healthcare practitioner, to further understand what to be aware of. And if these three major symptoms of severe L405 disc bulge, L5S1 disc bulge do show up, then now you know at least what to do about it.